Hey, welcome to Lung Lab. My name is Louis Reda. I'm the respiratory therapist reviewing one of the unique products that we just got to unbox. It is CircuitLife's circuit for the IPV line of therapy devices. So everything that we're sort of used to, you still have your harness and circuit to be able to attach everything to. You still have standard red, white, and yellow tubing. Yellow tubing is going to go for your nebulizer. It is a 90-degree angle. You want to push and click. Same thing with our red line. There's a red sticker here in the front. You match those up, push, nice snap. And then the white one, you'll notice there's a white sticker in the back of the connection cap. That right there is your setup. As easy as that, and you're ready to go. You of course want to still use your standard normal saline in order to aerosol or generate the humidification or the really the moisture for the patient. Think of it, we have a dry gas source coming from the back of the patient. You need that moisture in order to make sure that we have we don't irritate the airways. So with that being said, when we have our device connected, it's virtually 360. You're going to be able to move it in any direction that you need to. If you do want to take it apart for cleaning purposes, you just point it in the upper direction. There's a little notch, and you just go ahead and it comes right off. You'll notice the notch at the top and bottom of the unit, and you just want to match that up to this piece here. So very thoughtfully designed, classic circuit that connects. You still have your entrainment on this side here that's going to draw in flow, along with the flow that gets drawn in with the nebulizer. Exhalation is found here on the side, so you'll see a nice stream of vapor moisture that's coming out of the device, and mouthpiece connection where you can do your treatment. Now, when you're utilizing IPV, on the other end, it's going to connect to the unit, still color coded. The filter goes closer to the machine side, and you have these nice connectors to be able to pull on and push in order to get that nice snap that you want out of it each time to ensure that you have a good connection. You have an additional knob here at the top, not really a knob, but more of a connector. If you notice it, you can zoom in and look at it. It'll give you an additional snap. This is an entry point in order to add oxygen into the unit. So great feature, very thoughtful, especially in the sense that if you need to use this at home DME companies, home health, your SNFs, certain types of LTAC facilities, and let's say we're not using a gas source from the wall, you can bleed in oxygen. And by putting your oxygen here, it is going to entrain and feed into the unit, right? Versus having to add a bunch of connectors on the front side and add your oxygen. With that being said, there's really no change on how to utilize it. One of the key features to observe, though, is the entrainment on this works exceptionally well. So you are going to be able to draw in more gas and consume less from this line, meaning when you're utilizing your device, you're going to notice this. And if you have any questions on this, you can definitely email me and send me a message. But you can tell this on your device. If you're working pip for pip being the same, you begin to increase your operating pressure, your PSI, and that will in turn perform on increase in your pip, right? Your peak pressure. When you do that, you're going to have a higher threshold to reach higher limits, right? You can still work on the lower end. All it means is that you're going to decrease your operating pressure as low as you need it to go in order to get a proper chest wiggle from your patient based off your assessment. We have videos that cover that. But when you do that, your threshold is going to widen, right? If you have a higher level device like the IPV2C, like the TXP, transport bronchotron, or VDR, any of the devices that have a green knob, either labeled inspiratory flow or pulsatile flow rate, you have the ability to fully control the pressure, right? So the lower end doesn't really matter on those, because if I wanted to achieve a map of 2, you just turn the dial down, right? If I wanted to turn off, I could. I just turn the dial down, or decrease the flow. But on the upper range, so maybe not so much for like your pediatric patients, but I think we've all had, you know, maybe some severe or really chronic pediatric patients in the ICU. Sometimes on the adult world, some COPDers, kind of CHF combinations that really just need higher set pressure, especially if we're using non-invasive masks and we're kind of getting a lot of leaks and loss, where you can max out your device and you're still not sufficiently percussing effectively with your patient. You're gonna have higher thresholds with this one because of the performance that it has. So definitely some unique features there. Again, if you have any questions on wanting to look at what that, you know, how to test that, how to showcase it, by all means, reach out to me. I'll be happy to show you guys. It's one of the expertise that I've spent over the years working with IPV. So a lot of the materials I have is open source. You can find other videos online that I've done on YouTube. So I'm more than happy to kind of share that material. Along with that, inside, when you pull it up, you have a quick start reference guide that's going to give you all the information. I'll take pictures and post that on there. You can also find that on their website. And you will also get a instruction for use manual that is very nicely designed and easy to read and use. Comes in the major languages that, you know, we'll probably find here in the States. Spanish, English, of course, French, I guess, and a lot of Italian language or European languages. So Italian, Netherlands, and a few other. So good product. Happy to start using it. And if you guys have any questions, feel free to ask. See you soon. Thanks. Bye.